Hi, everyone. So I recently came across this framework. So this framework is new to me and it's relatively also recent. So I believe this work was published officially back in 2019. So this framework was developed by the National Institute on Minority Health and Health Disparities, which is under NIH, or the National Institutes of Health. And basically, what this framework speaks to or addresses is that health disparities persist across multiple domains: biological, behavioral, physical, or built environment, socio-cultural environment, and the healthcare system that can influence health outcomes at numerous levels, including the individual, interpersonal, community, and societal. So what this model includes and specifies is that health outcomes can span multiple levels, and it also includes a life course perspective component that emphasizes the importance of considering other factors that range across the lifespan, and not just like a cross-sectional, one-time only view. So what the framework looks like is this. So there's levels of influence, there's domains of influence, there's health outcomes. And so when I'm looking at this, it does remind me of the social ecological model, but just with a more of a health disparities lens to it. So I do think this can be helpful as a starting point if you're working around health disparities. There is also an article that talks more about the background of it, provides more detail about this framework. It provides definitions as well. One thing that I did find interesting in this article was that they looked at NIH R01 grants for the year 2015, and they looked at what level of influence these grants addressed. And so we can see that most of them addressed the individual and interpersonal levels, some community, and a few societal. And I feel like this kind of speaks to how we typically think about and try to address health issues in general. And so obviously, more work is needed. So again, the Minority Health and Health Disparities Framework.